Moving to Ireland sounds like a dream, but one thing catches nearly every American off guard. Healthcare works completely differently there, and getting it wrong could cost you thousands. Ireland runs a two-tier healthcare system managed by the Health Service Executive, or HSE. There's a public side funded by the state and a private side where insurance gets you faster access and better facilities. As an American arriving in Ireland, you are not automatically entitled to free public care, so planning ahead is essential. Most American expats will need private health insurance for at least their first 1 to 2 years in Ireland. That's because public entitlements are tied to ordinary residency, meaning you intend to stay for at least a year, and in many cases to PRSI, Ireland's social insurance contribution system built up through working and paying in over time. If you're moving to Ireland on a Stamp 0 visa, the route popular with retirees and people of independent means, private medical insurance is not optional. It's a legal condition of your permission to stay, and Stamp 0 holders are not entitled to state-funded public health services or a medical card at all. The medical card is the most valuable public health care entitlement in Ireland. It covers free GP visits, free public hospital care, and subsidized prescriptions. But it's means-tested. You won't receive one simply for arriving. You'll need to establish ordinary residency and fall below the income threshold set by the HSE. Over 70s get a slightly easier path. They qualify for a medical card if gross income is below €550 per week as a single person or €1,050 as a couple. Under 70s are assessed on net income after tax, with deductions for rent, childcare, and other costs. Applications go through your local HSE office or mywelfare.ie and take roughly 4 to 6 weeks. Just above the medical card threshold sits the GP visit card, which covers free GP visits only, not hospital charges or prescriptions. Since August 2023, every child under 8 in Ireland qualifies for a free GP visit card regardless of family income. For newly arrived Americans, this card can be a valuable bridge while you settle in. Ireland's private health insurance market has 3 main providers: VHI Healthcare, Laya Healthcare, and Irish Life Health. All 3 are regulated by the Health Insurance Authority and must follow community rating, meaning they legally cannot charge you more because of your age or pre-existing health conditions. Typical private health insurance for a single adult in Ireland runs from around €1,200 to €2,500 per year, depending on the level of cover. A family plan typically costs between €3,500 and €6,000 annually. Basic plans cover semi-private hospital accommodation. Higher tier plans add private rooms, faster specialist access, and some overseas emergency cover. There's a critical rule called lifetime community rating. If you take out Irish private health insurance for the first time after age 34, you pay a 2% surcharge for every year above that age, up to a maximum of 70%. This means the longer you wait to get covered after arriving, the more expensive your premiums become, so acting early really does matter. One thing many Americans don't realize until it's too late: Medicare does not follow you across the Atlantic. Once you move to Ireland, your U.S. Medicare coverage generally does not apply to care received there. That makes having proper Irish private insurance or qualifying for public entitlements not just smart planning, but a genuine financial necessity. There's a lot more detail in the full guide over on Love Ireland, including prescription charge specifics, how to register with a GP, and what the 2026 health budget means for expats. Join over 64,000 Ireland lovers and read the full article free at Love Ireland.